Heart failure accredited hospitals attain proficiency in caring for their heart failure patients and providing valuable resources within the community to help manage the disease. Kristen Butler, Chest Pain and Heart Failure Program Coordinator at Salina Regional Health Center, joins me today. Well, Kristen, thank you so much for being on the show. We're going to be talking about heart failure accreditation. Why is that so important?
Well, we really had to look at the state of heart failure in our region. Cardiovascular disease is still the #1 killer in the state of Kansas, and it's the 20th highest reason for mortality and morbidity nationally. There are some resources that state that by 2030, there will be 8 million or 1 in 33 people that will be affected by heart failure. So in realizing that this was our future, Salina Regional really took the initiative to take on excellence in cardiovascular care through accreditation.
Let's take a look at the accreditation process, what you've gone through for the past year.
Incidentally, we are the first and currently only ACC Heart Failure Accredited Center in the state of Kansas. The accreditation phase is a year-long process in which we identify any gaps in care in which we can improve, namely communication within our ancillary departments and through the continuum of care.
And this is not just for the accreditation, but it's an ongoing situation, right?
Patient-centered care is our goal. These accreditations really give us the tools to be successful in process improvement, which is continuous and ongoing. Salina Regional has an extensive service area, so those patients in North Central Kansas can now feel confident that they have the highest caliber of cardiovascular care here at Salina Regional.
And I know you've kind of talked about some of the things you've done. It's not just you doing it, correct? Let's talk about some of the team members or departments that are involved.
Right, so these patients are often very sick patients and have other comorbidities. And so it was a process to get all the right people at that patient's bedside. So if you think about the continuum of care, starting in the ED is usually where our patients come in. Our doors, the ED physicians, ED nurses, pharmacy, and I don't want to leave anyone out because they're all very important to patient care, care management, pharmacy, all the way through to our inpatient rehab and cardiac rehab centers. Incidentally, we also have a transitional care model in which those patients that do qualify can have visits in their home, which will continue that education, much needed education for that patient.
Thank you so much for some great information. And thank you for watching. For more information, please visit srhc.com, like us on Facebook, follow us on Twitter and Instagram.